Good evening. My name is Dr. Adrian Talley, and I'm the superintendent of Indian Prairie School District. I would like to welcome you to our fourth Parent University, Navigating Stress in Stressful Times. Tonight's presentation will focus on assistance for families who are looking for resources to help in managing the stressors caused by the COVID-19 pandemic. Our panel of experts this evening will provide you with information on where you can obtain resources within your school and how you can help your children at home. I am most delighted to introduce our panelists right now. We have Dr. Dave Koopmann, District 204 Psychologist Coordinator and School Psychologist at Waubonsie Valley High School. Ms. Tanya Shea, School Psychologist at Young and Bilta Elementary Schools. Ms. Liace, School Psychologist at Hill Middle School, and Ms. Janine Wange, Mental Health Coordinator and School Psychologist at Metea Valley High School. I'm excited to moderate the discussion this evening and welcome all of you. Before we get started with our discussion, I want to allow our audience the opportunity to get to know each of our panelists. Could you each please introduce yourselves with your name, position, and share a little bit about how you support our students and our families? Why don't we start with you, Dr. Koopmann?
Hey, I'm David Koopmann. I've been in the district for 24 years, and of those 24 years, I've always been at Waubonsie Valley. Just personally speaking, I mean, I have two adult children, adults, one who is in college and one who recently graduated college. But, I do want to say that, working in Indian Prairie District for 24 years has brought me a lot of joy and success. It's really been an honor to work here just because of what our district has to offer. I'm not only a parent in the district, but then also being a school psychologist at Waubonsie.
Thank you very much, Dr. Koopmann. Ms. Shea?
I'm Tanya Shea, and I am a school psychologist at two elementaries, Young Elementary and at Bilta. And I also have got children that went through our school district. So I feel like, it's an amazing district to not only work in, but to also raise my kids. And so I have a daughter who's in college, and my son is a senior this year at Waubonsie. And it has been great working in the district, and I have been here 20 years.
Wonderful. Very good. Lisa Liace, will you introduce yourself? And will you please help me with your last name again?
Lisa Liace, you got it. I'm the school psychologist at Hill Middle School. I've been there for just about 8 years now. I'm a mother as well, but to a toddler, so not quite school age yet. But I have been at Hill the whole time that I've been at Indian Prairie. So I really enjoy working with 6th, 7th, and 8th grade. I work with students, I work with parents,
she'll be
teachers and other staff. So they come in, and I love seeing kids as they leave for high school.
Wonderful. Thank you so much. And Ms. Wange?
All right, I'm Janine Wange. I'm one of our, I'm a school psychologist by background, and I'm also our mental health coordinator at Metea Valley. I've been in the district 18 years, and I started at Crone Middle School and moved into Neuqua Valley, and have been at Metea since we opened in 2009, and have worked with all students, all types of students from many different backgrounds, and have enjoyed my time in the district as well. I also have a younger student in the district, my own child. He's a first grade student. So I'm on the other end of you both in terms of being a parent, but it's an interesting experience having a first grader.
Thank you so much. What I find most wonderful about all of you is your longevity in Indian Prairie, your longevity even in your individual schools, which is great. And then the fact that all of you are parents, you're dealing with some of these own stressors yourselves. And so what you're able to offer through your professional advice tonight, and also your personal advice, because of the fact that you're dealing with this on your own. So this, I think, will be an exciting, wonderful discussion this evening. So let's start talking about what you are seeing among your students and what you're doing to support them during this transition to hybrid, and for those staying in remote. Can you each give us some insights?
Sure, I could start. Obviously very excited about seeing students back in the buildings. That's really something that I think all of us as educators have really kind of been hoping for a long time. So hopefully, seeing those students as they start, some started this week, but most of the students starting next week is really going to be exciting to kind of bring life back to our buildings. And again, we know that this again is a very difficult time for parents to choose, whether it's the hybrid model or to stay remote. But the thing to keep in mind is that as school staff, we're going to continue to support students, whether they are remote or hybrid. And students need to realize, just as we all have realized, that we need to kind of just take these challenges as they come and we have to deal with them, and we have to just learn to pivot, laugh it off, and we learn to, improve as we move through this, because it's going to be challenging times for everybody. And when can we ever say that we've had the first day of school theoretically at the end of January? So it's really going to be interesting for all of our kids when they come back to schools.
Anyone else?
Sure, I'll go next. What I've been impressed with is the high school students I work with, and as a mental health coordinator, I work a lot with students who are really struggling emotionally and, with their mental health, and some of the resiliency that I've seen in students and the hope for the future and the optimism. Not putting aside what we're going through, but they're also very, very. Our kids are amazing in this district, so just to see them and talk to them and see them through this, and the resiliency is amazing. But one thing I have noticed is that students are, at least our high school students, seem to be functioning or struggling with executive functioning, which when we talk about executive functioning, that's really the frontal lobe. It's managing your managing organization, time management, prioritizing work, all of those things, like turning things in, things that a school structure I think helps with the routine of the day. And so that's something that I think some of our students are struggling with, and it's maybe causing stress overload or anxiety because they're not able to manage it as well independently on their own at home. So I'm hoping too that having more students in the building is going to help set that routine for students. But also there are students who are struggling with lack of other routines, like for example, sports and things like that. And so just talking to those students, trying to build something into their routine, like something to look forward to, something else that can replace what's been lost. Those are some of the things that I've seen with our students.
I think just to bounce off what Janine was saying, at the middle school level, we're definitely seeing those difficulties with executive functioning as well. And I think it's a challenge for middle school and for high school and elementary to begin with, because those skills really aren't fully developed until you're in your 20s. So it's already a challenge. And then when you throw in all these changes with routines and with schedules, it is taxing. So a lot of what we've been doing is trying to build up those routines as much as possible, and working with parents and working with our teachers on, how do we make things as structured as possible in this much less structured type environment that we're in.
Mm-hmm. Even in the elementary, we're definitely seeing, the Zoom fatigue, where the kids are they're tired, they're turning off the screens, they're not, they're muting themselves. So we've been trying to really build up those relationships, especially elementary children. They perform because they really love their teachers and they build those relationships. And that's why we see a lot of them do as well as they do. And so helping our little ones see that the teacher's not just this little posted stamp on the screen, and build that relationship. So we've been trying a lot to do, having the teachers do more small groups, some more breakout rooms, some more one-on-one with the children. And we're hoping, even if for the children that are staying remote, that the change in the schedule with the new hybrid schedule will kind of break up the monotony a little bit and change things up. And if there's any silver lining in any of this, I do think the communication has increased tremendously through all of this, through the school versus with the home. I feel like, we're getting little glimpses into the home, and then the parents are getting glimpses into the classroom. So I think the communication has really been beneficial, and I think that will also help our children adapt to all of this.
Well, the theme I heard throughout all of you was definitely about the routines. Routines are so important, and sometimes our children may say that they don't like routines, but really we know that they actually do. If we think about them when they were children, babies, and they actually did better with routines, and we know that this is very important to them. And so I agree with you guys so much with what you're saying there. Tell me, please, or tell us some great information. That's all great information. What are you doing to support students from I'm sorry, how do you recommend parents talk to their children about their behavior and attitudes?
Well, I think the language that, we use as professionals, that parents use with their kids, I think it's really important. And a lot of what we're seeing, with the world around us, not just the pandemic, but everything else that's going on, it is creating a lot of stress. We have kids who are talking about it, and which is excellent, but we have to work on how we frame some of what we're saying. At the middle school level, a lot of what I hear from kids who are struggling are like, this is too hard. I can't do this. I'm not capable. I can't stay online all day. But working with a kid, we get that frustration, we hear it, we have to try to reframe that. And I think it's important to reflect that student and that child and say, I hear you, like, it's hard, I get that. And no one's going to lie and say that it's easy, but you are also surviving this. You are using these skills. You have done this. You have been doing it. Let's look at those positives and see how we can use those skills that you are gaining to move forward. A lot of that is just reframing that struggle. I think I hear a lot about toxic positivity where, sometimes people want to just focus on everything's great and everything's wonderful and let's just look at the bright side all the time. But the reality is things are challenging and it's okay to acknowledge that. And I think it's important to acknowledge that. It's important for parents to have those conversations with their kids and say, yeah, this is really hard, but I'm also really proud of you for getting through this. Look at these skills that you are gaining.
I think having the children feel heard. I think sometimes, we feel like the day's just so busy and we're trying to get the kids on the screen, and but actually taking time and asking the child, hey, what are you feeling? How are you coping? How are you dealing with this? What can I do? Because sometimes they have some insight, or they may be worrying about things that we don't even know that they're worrying about. And I think kind of opening that door that they're not alone. And I think for the little ones, reassuring them that there's lots of people that are trying to keep them safe, and that that the teachers, there's doctors, there's researchers working on vaccines, there's all these people across the United States that are working really hard to keep you safe. You are not alone. And I think helping them feel that also can decrease some stress.
I think just to add one more point to that is really reframing, as Lisa indicated, but reframing the need to say that there's a lot of unnecessary worry, which is causing people to be anxious. But the one thing that you can do is continue to think about what can you control versus what you can't control. The more we think about what we can't control causes us more anxiety. So if we can focus on what we can control, I think then it helps us reduce our overall fears to be successful by moving into, the new directions of opening up the buildings.
I agree. And I would say, even if I take off my psychologist hat and talk just as a parent, sometimes we have to catch ourselves, because there are things going around us that we as adults are struggling to understand and to manage. And so we have to really check ourselves sometimes and realize, like, your kids are, especially me having a 6.5-year-old, they do digest what you're saying, and they do pick up on your tone, and they do pick up on your own worry and your own anxieties. And I think sometimes not to be ingenuine, we need to be genuine with our kids and what we're feeling, but also, trying to reframe ourselves when we're talking to them about things, and saying, like, I don't understand it. This is hard for me to digest. So I get what you're feeling, but we're gonna work through this, and it's gonna be okay. I think we just, we all as parents have to be cautious about the way that we say things to our kids.
There is no instruction book for being a parent, and there definitely isn't an instruction book for being a parent during a pandemic. I really
Yes.
appreciated what you said with regards to reframing ourselves, and just remembering that and understanding how we say things to our kids is truly an important thing as we go through this, and giving ourselves a little bit of grace as a parent, because this is all new to all of us. And I think that's an important thing for us to remember.
Exactly.
So help us understand what you are doing to support students from a social emotional learning perspective.
I can start at the elementary. Elementary has, across the district, has blocked SEL time into the schedule. So that's social emotional learning time that the teachers can really focus on, just kind of checking in with the kids, seeing how they're doing, seeing how they're feeling. There is a specific curriculum that the teachers are able to grab and utilize. It's called Second Steps. It's a very specific, curriculum that's evidence-based, that in research-based, that kind of walks the teachers through, helping the kids understand their emotions, how they're dealing with emotions, relationships, bullying. It kind of covers the whole entire gamut. And so that the teachers can pull from. They also have, multitude of other resources. And what's really nice is teachers know that that whole SEL, although there's a block of time to kind of, specifically talk about a lesson, the teaching that they do throughout the entire day is what really benefits. So, throughout their even ELA time, the books that they're reading, let's talk about that. What is the author thinking and feeling, and why are they feeling that way? And so they're talking about it pretty much, throughout the day as well. And then they've got a little checkout point at the end of the day, just to check in with kids and see how they're doing, kind of get a gauge. And then children that are struggling, that need to kind of stay on, the teachers will shut down with the rest of the class and maybe stay on with a few that are needing some help and some support. So that's, one way at the overall tier one, the whole school kind of level that we're helping support.
And then at the middle school, we also continue with the second step curriculum. So we do that once a week. It's a set time. Every teacher teaches that piece, and it builds on those same lessons that kids are learning in elementary. So it looks at, empathy skills. It looks at bullying and harassment and how to spot those things and how to stop those things. It looks at emotions and emotion management. So really good skills that, again, are woven in throughout our curriculum. We do have state standards for social emotional learning that our teachers do try to weave in, not just in that SEL time, but in ELA, in social studies, in science. We want our kids to connect with the world and connect to other people. So those skills are really important throughout their day. As Tanya was saying, we want to keep returning to those lessons. So beyond that tier one instruction piece, at our school, we do have weekly meetings. I know a lot of schools within our district have those problem solving times with their teams, where have opportunities to talk through what are issues that are coming up in certain classrooms. How do we address them? Personally, I meet with our teachers once a week, and we have those chances to really look at, okay, like what students are maybe not engaged right now? How do we reach out to them? I think a big piece of that is just that communication. Our student services staff communicates with all of the staff in our building. And I can say that that's consistent among all of the buildings in our district, because it is so important for us to know what's going on everywhere so that we can build those levels of support.
Okay. Dave, you want me to talk about the high school?
Sure.
Okay. So at the high school level, we rolled out our tier one this year. And when we talk about tier one, it's making sure that every student in the school is receiving the intervention. So our intervention for social emotional learning is School Connect. And that's, again, it's like Second Step, but it's more developmentally appropriate for the high school age student. And again, it talks about a lot of the same skills. One of my favorites is actually coping with stress. That's one of my favorite lessons in there. So we do that in our PE classes this year, which actually isn't how we originally planned to do it, but we pivoted with the pandemic and we changed things up, and our PE teachers have been absolutely amazing and just willing to deliver this curriculum and actually loving it. and wanting to make sure they continue with it. So they've loved it this year, but they deliver those lessons to our students across the whole district. And then for next year, we're planning what our tier 2 will be. So for those students who rise out of the tier 1, who maybe aren't responding to that, or they need more support than just lessons in class, what are we going to do? So the planning has started for next year about what is that tier 2 going to look like for students who need additional support. Not to say we haven't always provided additional support. We have groups running. We have individual counseling sessions with students. We have things like that going on to connect with students all the time. But this is a more systemic way to make sure that we are reaching all of the students that need that extra level of support, not just the ones that are kind of the squeaky wheel, if that makes sense. So we're working to build that into our system for next year, but it's been really exciting this year rolling out our new curriculum.
I think what's been really great at just all levels is the push to really build the capacity for kids to talk about their social, emotional concerns and issues, because, I think we are aware of a lot of those students who are struggling really significantly, but we don't want to miss those kids who might have lower level type issues or things that are growing. We want to catch those issues before they become until they turn into big problems. So we're building that capacity for kids to identify their feelings, to know how to express their feelings, and learn how to seek out help earlier rather than later.
I think it's really exciting right now because historically speaking, I mean, if you think about, for all the parents that are watching today's presentation, when did you ever talk about emotions or feelings as you were going through school? So now just the recognition that mental health or emotions or feelings or the expression of those feelings, that we're actually receptive to that now, is really exciting for us. And, again, I think we're fortunate that, as a district, we're able to implement this curriculum so that, children begin to start to identify what emotions they're experiencing so that it's not bottled up and it doesn't, just continue to stay inside. They know that they have support that they can talk to, whether it's a teacher or anybody else that they confide in the buildings. But it really gives kids an opportunity to realize that it's okay to feel the way that I feel, and that they have a trusted adult that they can turn to.
I think it's wonderful that Indian Prairie has been very planful and thoughtful as they've done with SEL work. When we think about it, we have second step, that's K-8, which is very good. It sort of builds on itself, and we know that the children in our program K-8 have that. And at high school, we have School Connect, which is another program somewhat connected to, similar to what Second Step is, which is, I think, very good and wonderful. Just for our audience, can you please explain, because you've been talking about Tier 1 and Tier 2, who might provide Tier 1 versus who might provide Tier 2? And I think there was a little bit of discussion about what the two are about, but just can you just explain that a little bit more for our people?
Sure, I will. So Tier 1 is usually implemented by general education teachers. And really, research has shown that these programs that we're talking about are best implemented by those teachers because there's a relationship there. And sometimes in the past we've said, okay, the social worker, the psychologist, we're going to pop in and give this lesson, but really the teachers do an amazing job, and then they can reinforce it throughout the week, like Tanya Shea was saying. So it's really cool to have that the teacher do that piece. And then Tier 2 can be done by anyone in the building, really. I mean, it's anyone who has an expertise to do whatever needs to be done. So, if it's running a group on managing stress, since we're talking about that today. If it's running a group on that, maybe it's the social worker, or the psychologist, or maybe it's a counselor, or maybe it's a teacher who has a special interest in working with students on this topic and is proficient in it. I mean, it doesn't have to be a therapy group. It can be a discussion group. So it's really just a smaller group of students that are more targeted in receiving whatever they're receiving.
Wonderful. Thank you very much for that explanation. I think that helps. So what resources are available for parents who may be looking for a referral?
Okay.
I can go ahead and answer that. I mean, so if parents are looking for a referral or just advice or somebody to kind of bounce ideas off of, okay, each school is equipped, or it has in their staff a social worker, a psychologist, a school counselor at the middle school and high school level, a student services coordinator, or even the teacher. If a parent needs to reach out, they can reach out to anybody in their school building, and then that information will be passed on to whoever the appropriate staff member would be. If referrals are needed for an outside provider, then we can, give a list of names, okay, of people that parents could turn to see if that's a good fit for their child. Regardless, I mean, we also have the 204 tip line if you have a concern, okay? And that's a line, that's an anonymous line that students or parents can turn to. And then there will be follow-up after that call is made on the tip line to the school that that student attends. But again, the one thing that we want parents to realize is that we do have available resources in our building. So parents can always turn to and just at least ask the question or start the dialogue. Kind of holding that in and not letting the staff know or even the teacher know. Teachers do their best to kind of see everything that's going on with their kids and, knowing everything that's happening. But sometimes it just takes a little bit more with the parent reaching out, talking to the teacher, and then if the teacher can't answer the questions, then they'll forward it on to the appropriate staff member in the building.
One thing I wanted to add on to your referral, referral answer was how cool it is that we have a system now that will allow us to put in insurance coverage, languages spoken, different characteristics that people might be looking for, and it kind of filters through all of the practices in the area and will give us a list of those who would meet certain criteria that parents are looking for. So I think it's really cool. We've had that system for probably three or 4 years now.
And that system's really nice too, because you can specify, somebody who specializes in a certain age group. So it's been great for like the elementary to be able to say, we're looking specifically for somebody within a 5-mile radius that works with elementary age. I specifically need somebody who, is dealing with ADHD or depression, and you can put the specifics in, and it has been very beneficial for a lot of parents. So.
Yeah. And to echo Dave again, I mean, really don't hesitate to contact someone at the school, because I think that especially when we have students who are remote or hybrid, as we are right now, we really need to be in partnership. And so when there's a concern, we want to know so that we can intervene and care for that child. So just to reiterate that, to reach out whenever there's anything that's really out of the ordinary that you're concerned about. And even if it's not a big deal, at least, one of us can talk you through it and try to figure out what next steps could be.
Thank you. So I have some questions that have come into us from parents. So I'm going to get through as many of them as we can in the next 30 minutes. So question 1, what resources are available in schools to support mental health concerns?
Well, I think as we've kind of mentioned, we do have school psychologists, we have social workers, middle and high school has guidance counselors who are available. So we do have different mental health professionals who are available as supports. And, the sports will kind of flex depending on what the student body needs. So, some years we have a lot of kids who are experiencing anxiety. So then we offer opportunities to work on those skills with kids, work on applying certain coping strategies within the classroom throughout their school day. Other years, we see more concerns with other mental health issues or more executive functioning issues. So we do kind of flex, so we have all these professionals available. A lot of that it just comes through communication with the parents and learning about what children need. So, I would say the supports kind of depend on what we see and what we're hearing.
I know that we also have some staff who've been trained in mental health first aid. So we really, as a district, I think have been very much focused on this area, if I'm not mistaken.
Mm-hmm. Mm-hmm. Yeah.
Next question. How do you keep your teen motivated for school despite the lack of social interaction and Zoom fatigue?
I'll give you some tips for elementary, things that we've been trying to help support some elementary kiddos. I think the biggest thing is the schedule. We have little ones that, in elementary, they can't even tell time. So they're really struggling with knowing the end of their day. So if you put that schedule even in like a sleeve that they can then cross off, I've had my reading lesson, I've now moved on to math, and they can kind of see that there's going to be an end in sight. I think that helps little ones tremendously know kind of what to expect and when to expect it. Some of the other things to kind of help them stay motivated during Zoom.
Uh-oh.
Tanya has frozen, so
In a great position.
Actually,
we got her.
back to him. Good.
Sorry, did I freeze?
A little bit.
So fidgets, was I on fidgets? The other thing I was going to say is fidgets are big for our little kids. They need movement. So playing with putty, and it's great in this setting because they can hide it and nobody sees it. And as long as it's not keeping their focus on the putty and what they're playing with, they're still able to focus. That has helped a lot. Simple things is crunchy snacks, water bottle, chewing gum, all the things we as adults have figured out what we need to keep ourselves alert, will help the children as well. And movement breaks, they need movement breaks throughout the day. Don't let them sit for very long. Have them take the dog around the house for 2 minutes and then come back. So those types of things have been very helpful for our elementary kids.
Wonderful. Thank you.
I would agree with everything that Tanya has said, even for middle school. I think that would be helpful. But I also think, for the parents watching, it's important to remember that your kids best and your kids' limits. And sometimes kids hit a limit with how much they can sit in a chair and be on Zoom. So sometimes you do have to prioritize what is most important throughout their day. And ideally, we want our kids interacting with their other peers throughout, and with their teachers throughout their Zoom sessions. So if they can just be there to interact and get as much of that, social emotional time, that content interaction time as possible, that's great. And then if they need to take a break from the computer in order to get through the day, that's fine too. I think we all recognize that we're working with kids and it takes a lot to sit and to focus all day. It is hard for adults too. I don't think any of us can sit and stare at a computer screen for hours and hours on end. So sometimes we just have to prioritize. You have to think about what is the most important part of this school day that my child needs to get. And that's what we're going to focus on for this day.
I think, going back to what can we do for teens too, it's one thing is, you have to have a carrot. Like kids have to work for something, and it could be, it doesn't have to be, a tangible thing. It could be, get this done first. That's a big thing in our house is and actually today I was just talking about how I need to drink more water. So my carrot is I get coffee after my water. So we all, even 40-something-year-olds need carrots. We need something to work for and something to look forward to. So it's setting them up for success in that way. Maybe for your child, it's having them do the hardest things first and then do the easier things. Or maybe it's setting up something that they can look forward to on the weekend. So in terms of socialization, I would argue that our students need to be socializing in whatever way is safe outside of school, because we've got to set that up for them. And so whether it's play dates that are masked outside with people you're always around, like neighbors, or whatever, however you can get that need met. So for our teens, sometimes it does mean more phone or screen time, unfortunately, but that's just the world we're in right now. And actually, I was just talking to a student a couple of days ago, and she was telling me about an app that allows you to watch movies with your friends, and you can chat while you're on there. And I can't remember what it's called, but it is. We've got to be creative in our ways to make sure that they are socializing and that they are getting those needs met, because there are needs that we all have. Yeah.
I think even trying to get creative, it's seating arrangements. Some kids cannot sit at a table and a desk. So if they're under, their bunk bed, or they've made a tent And guess what? Today we're going to do our Zoom lessons under a tent. Something different, something, you know, motivating. I think that can help as well, because it's changing, you know, changing your environment a little bit sometimes can make a world of difference. So mixing it up.
And I think from an executive functioning perspective, you know, it's really hard for kids and teens to visualize the future even a week ahead of time. So setting some of those short-term goals and looking at the focus for, you know, what are we doing today? What are we doing today and tomorrow? That's going to help kids get through some of that a lot better than if we're setting that, like, okay, by the end of the quarter or a month from now. It's really hard for our kids to visualize that because they just don't have that capacity yet. That, again, doesn't come until you're in your 20s about. So we have to work with those kids where they're at and really work on building those skills, giving them those short-term pieces and dangling those carrots so that they can get those rewards frequently. And that, I think, will help keep them a little bit more engaged and motivated.
Yeah, I think one more point is that we have to realize that distractibility is the norm. When you have, you know, a couple siblings who are going to school through Zoom, you've got parents who are working through Zoom, you've got the dog running around the house, you've got, you know, the refrigerator so close. I mean, these are things that we have to realize that, you know, because this is unique, we just don't have that traditional setting where the structure is the norm. So I think we have to realize that we have to be patient about what we expect a learning environment to look like when students are at home, but then also be understanding that distractibility is the norm.
As adults, we deal with distractibility as well, and so we have to expect that our children are dealing with it, and how do we, you know, resolve those issues? Really important. Next question: how can parents negotiate when their children's friends' parents have less restrictive values related to mask wearing and socialization during COVID? It's hard to enforce guidelines when with my teen when it seems everyone else is more lax.
I think that's a challenging one. I think I would approach it the same way, you know, you would if, you know, your child is questioning, well, like, why do my friends get to stay up later and I have to go to bed at a certain time? It's important to have, you know, age appropriate conversations with your kids about the reasoning behind things. And, you know, the rules for your family might look different from the rules for another family. And it doesn't mean that one is more right than the other, but you have to talk about, like, well, this is why we're doing this. You know, we're wearing masks because, you know, this piece is important to us. This is how it impacts our family. I think kids are able to understand those things as long as we're using that, you know, developmentally appropriate language. But the more we can talk about the whys, the better able kids are, I think, to really take that knowledge in and move forward with it. They might not like it, they might still push a little bit, but it's important for kids to understand our reasoning rather than just, you know, well, we're doing things different and that's just the way it is. You know, the kids are always going to be questioning those pieces. I think that's, you know, a part of being a parent is that we have to learn how to set those boundaries, but then, you know, say, well, this is why it's important for our family. This is why I'm holding that boundary for us.
I would even argue with teenagers that they should be involved in the conversation, not about your rules, not about like how to be safe, but about how to get their needs met in another way. You know, because you can say, we're not doing this or this or this, but let's talk about, you know, you want to socialize. So how else can we get your needs met, and how can you socialize in a way that our family believes is safe, and involving them in that? Because I think teenagers rebel when the rule is the rule and there's no why behind it, and there's no discussion at all. I'm not saying to bend, like I said, because the rule is there for a reason, but also just knowing that they're young adults and they want to have a say in, you know, in their lives, and try to help them get that need met in a different way. I think that's important.
Understanding the why and being consistent, something that two things that are most important, I think, for the kids to deal with. How can parents manage the stress of having multiple young kids remote learning at home and generally home all the time? And so dealing with kids who are arguing, making messes, do they really do that? I don't believe that that's happening, etc.
I think not only giving grace to your kids because they're like ready to lose their minds, right? But grace to yourself. Your house is going to be messy. And the good news is you're not people over. So now's the time. And I think reminding ourselves, right, that this is not forever. We're going to get through this. One suggestion I have is, when you think about at like the elementary school or all of our schools, there's teachers' lounges. And there's a reason for teachers' lounges. And that's because we're with kids all day. And then we need to pull ourselves into the teacher's lounge and have some adult time to decompress. And I would highly suggest parents make a sign that says parent lounge, and they teach their children that this parent lounge sign means that this is a spot right now where no children are. And if that is your bedroom or that is your bathroom, it doesn't matter, but that you can pull yourself away for a little bit. It's the whole philosophy of on a plane, when that oxygen mask comes down, our first instinct as a parent is we put it on the kid, but you have to put it on yourself so that so then you can help your child. So you have to, as a parent, stay, healthy as well. So take that bubble bath, take a book, take some time. And it can even be a scheduled time in the evening where this is just downtime for everybody. Everybody has to find a quiet thing to do. You can go play Legos, you can go read a book, you can go draw, but everyone needs some downtime because everyone's getting on each other's nerves. And it is just kind of what the situation is. But to make the best of it, we need to be able to have our own downtime. And as parents, we need that as well.
I think you have to have permission to be human. And, a visualization that kind of helps me is, I'm sure everyone feels like we're juggling a million balls. Some of them are plastic, some of them are glass, and you are going to drop balls. But your goal is to make sure you're dropping the plastic ones rather than the glass ones. And your focus is going to change. Sometimes you have to prioritize some things over others. And, if you have to focus on your own self-care and let the cleaning go, let the dishes go, let those be those plastic balls that you drop. It is not going to drastically change your life. It might be frustrating, but we can let that go as long as we're holding on to those important things. And if you aren't taking care of yourself, there is no way you can take care of anyone else.
Earlier in our presentation, we talked about reframing. Okay. But I mean, that's probably the best way also to answer this question is look at this COVID event, the pandemic, as a way that when have our families ever been this close? And when have our families interacted as much as they have? So if you kind of take the negativity of the stress that the pandemic is causing and reframe it into this is kind of a unique time that our family has been together, and just kind of, again, let's call it 7 to 5, is the hard work time and everything. But then after that, for your family to be together and stay healthy together and to kind of look at this as an experience that this is a memory that everybody's going to have for a long time. But when you take it and maybe spin it to a positive, think of it as the time that you had with your family is a way to kind of spin the idea that we're in a pandemic.
Yeah. 100%. And also just making sure, we all have different level of resources that we have to help us out with things, but there are things that we can, like our basic needs need to be met first before we can feel okay. So, I mean, some of those things that we need to take care of before anything else is making sure that you're getting enough sleep, because everything's worse if you're not getting enough sleep. So if you have to let go of, dishes or whatever else after your kids go to bed, let go of it and have some downtime and make sure you get to bed at a reasonable time so that you're getting that sleep. Make sure that you're eating healthy. Make sure that your caffeine intake is in check. I'm guilty of that. Make sure that you're getting enough movement because our bodies crave movement and we need that. So those basic things that sometimes we forget about when we're go, 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 we forget that we have to fill our own cups first with those basic things, and then you can add on the other pieces that make us feel even better, like making sure that you're socializing with friends. So even if it's just, if you're with your kids all day, maybe it's just making sure that you text someone at night or you give someone a 10-minute phone call just to connect. But we all have different basic needs, and then the needs that on top of those that we really need to feel okay. And just check yourself and evaluate if you're getting those needs met first. And then if you are, I think things start to look a little bit better and more manageable.
Thank you, everyone. Next question is, there were several questions submitted specific to instances occurring in specific classes. The questions were asked how to handle bullying in breakout rooms as well as specific class assignments. So the question really is, what should parents do if class-specific issues occur?
I think you always start with the teacher. Always go back to the teacher. Sometimes you think that the teacher might be aware of something and they may truly not be aware of what's going on. And teachers want things to go smooth as well. So start at the teacher, and if the teacher, like for elementary, there's a lot of, like we've talked, there's a lot of different staff members. Depending on what the need is, the teacher may contact the reading improvement teacher. The teacher may contact the interventionist who helps with math. The teacher may contact, student services coordinator or the social worker or the psychologist. So they also will reach out to give that extra support if it's something that the teacher themselves feels that they cannot handle.
And I think that piece is also important because we do want to address issues as they are occurring. So if it's a bullying issue, for example, I would absolutely want to make sure the teacher is aware of that as soon as possible so that they can pay extra attention to what's going on, whether it's a breakout room or, another situation, or if there are other issues that are popping up. We do want our teachers to be that first line of defense because they are with those students every day or with that every class. So they're going to be able to notice things as they are happening. And like Tanya had said, they can definitely disseminate that information to anyone else who needs to know as we are looking at how to build supports.
And then I think it's important to note that, if things aren't happening, of course, we have amazing teachers and they always take care of everything. But if things aren't happening in a way that you feel is meeting the needs of your student, then go. There's a chain of command in schools, just like any business. There's people that you go to next if things aren't going well, and so give the opportunity to the teacher first to figure things out. But then at the different levels, there's different people that you go to next. So in the high school, it would be a department chair, or if it's related to guidance, it would be the director of guidance, and then it would be an assistant principal, and then it would be the principal. So there's a structure set up so that things can be taken care of, and people get their needs met.
Please reassure, though, as the parents that are watching this, is to really reinforce with your children that there is an open line of communication with you. Kids need to know that they can come to you with whatever their concerns are. Then you as the parent, you can ferret out what you can handle, what you maybe need more advice on. But the one thing, again, kids need to know that they can turn to their parent regardless of what their issue is, and for it not to be minimized. To take it at face value and to know that their concern is genuine and you'll do what you can as a parent to solve it. Whether or not it necessarily has an answer that could be done quickly, but the reassurance that you're helping your child deal with it sometimes is all the help that they need.
I'm so appreciative of what all of you said. I will reiterate that there are people in the schools who want to be there, who are there to help, to support. And if there is a problem, please reach out to them. Even in our remote learning phase, they are there to support, and they're there to answer your questions. We have about 12 minutes left before we have to end, and we have really two questions that we're going to ask. So the first of the two: how should parents manage the increase in screen time with general recommendations to reduce screen time?
Well, I think we have to recognize that we are in a unique situation. I know absolutely there are recommendations that we don't want our kids, looking at technology all day, day in, day out. However, we are not always going through a pandemic, and we have to be somewhat flexible given our situation. Plus, I think there are differences between the types of technology and screen time that we're using. If there are opportunities for kids to engage with other people, have back and forth conversations, I don't think that's a negative piece. I think that is a way that a kid can build those social interaction skills. They can learn if they're interacting in the classroom. I would prioritize that type of screen time over, just kind of mindless scrolling. But then also kids need that downtime, and kids need those breaks. And if for a kid that break is, playing a game for a little bit and that's their self-care, we might have to just be a little bit more flexible right now than maybe we typically would when we're not in this type of situation.
I had to laugh because my high schooler, is on video games, and I'm like, enough. And finally, we have a little talk, and he's like, Mom, this is how I'm socializing. He says, half the time I'm not really even playing the game. I have my headset on and I'm talking to my friends. And I had to step back and go, okay, the screen time is, yes, it seems to me like he is on video games all day long, but at the same time, that is how he's socializing. He's not able to socialize any other way right now. And so taking that, a step back, that in this setting, that is the way he's socializing and connecting with his friends. So.
And this isn't maybe popular, but it goes back to the question that we were asked about really surviving having multiple kids at home at the same time, doing remote learning, being together all the time. And, typically we wouldn't say, oh, you need a break, put your child on the screen. But I mean, honestly, parents have to take care of themselves first. You have to. And if you need an hour and you put your child on, watching an episode of Blippi or whatever, whatever show your child, I'm trying to think of what my kids are watching now. But if you have to do that, I mean, you have to give yourself grace to do that, because we have to be okay first. And so if you need a break, use it to take a break and be okay with it, and just be moderate with it, going forward, and be cognizant of how much time they're getting, but be okay with the fact that you got to take care of yourself, and that sometimes is a way to do it.
Take off some of the guilt.
Yes, exactly.
We all have the parent guilt.
Exactly.
I'll ask the very last question. I'd like to ask one final question of our panelists. Please give us a quick tip for parents. What is one thing they can do right now to help their children who are feeling stress?
For elementary, go ahead, Dave.
Well, I was just going to say, throughout the presentation, we've given a lot of tidbits, but I think, what we need to really reduce stress is make sure everybody's taking care of themselves, getting enough sleep, exercising. I mean, now more than ever, I think kids really need to take advantage of their PE classes and taking that opportunity to do the exercise. But we all need to do that. We all need an outlet. And I think for us to decrease our stress levels, we need to have that outlet. And whether it's working out, reading a book, watching TV, whatever you choose to do, that has to kind of be accepted by everybody, because your idea of reducing stress may not be the same as somebody else's.
And a big one that I think of is unplugging, turn off the news. Sometimes I don't think we realize that we've got the news playing in the background all the time, and our little kids are hearing it and absorbing it. And we just need to unplug from a lot of that, and then finding things to look forward to as a family. Something, hey, this weekend, let's go sledding. Let's, have a special meal. Let's watch a special movie or something that you can kind of look forward to as a family.
I think communication is one of the biggest things we can do to help everything. Whether that's communicating what your child is struggling with in school to their teachers, whether it's communicating, your boundaries, your expectations at home with your kids, and communicating with yourself. If you're feeling stressed, giving a voice to those emotions and saying, hey, I'm not feeling okay right now, I need a break. The more we can be open with what's going on, how we're feeling, how we're thinking, the better equipped we are to find a solution.
I think too, my tip, I think, would be just have a non-judgmental approach to talking to your kids about things so that they do feel comfortable coming to you. That doesn't mean they can do anything and you won't react. But we were kind of joking before we presented today about how psychologists learn to have kind of a flat affect or flat face, because you have to, you can't react to every little thing your child is saying, because they'll stop talking to you. And I think we all want our kids to tell us when they're really struggling, but also we can't always fix it either. So I think just to not overreact when they're struggling and want to fix it, because we do. Parents want to see their kids doing well. Just letting them have that voice and listening to them, and offering suggestions if they want them. But I think it's important to have that line open, and we, even me with my little 6.5-year-old, can shut it down because I'm nervous that he's not doing okay, instead of just being like, okay, you need to check yourself. He's going to be fine. Just let him talk, and and not overreact. So again, yeah, just learning how to be there for your kids is huge.
Wonderful. Well, this has been very informative discussion, and I'd like to thank each of you for sharing your expertise in this area. You shared both your professional and personal expertise, and I want to thank you for doing both. Thank you to our viewers for attending tonight's evening session. One of the things that I am taking away, again, is give yourself grace. I really think that's important right now. We have information on our homepage that includes the link to the presentation on the district's YouTube channel, contact information for our panelists, and a link to a webpage with mental health resources. Again, I say thank you to our panelists. Thank you to our viewers. I hope all of you have a wonderful evening. Stay healthy, stay well, and have a good night.